Yeah, one thing that I'm constantly reminding our agents about is when you're dealing with somebody at Social Security, or when you're having a client deal with somebody at Social Security, you've got to keep in mind that the people there at Social Security, they wear so many different hats. So if you scheduled an appointment or you walk into that, Social Security office and you sit down and meet with somebody, I just picture this. Picture that person is going to have to kind of reach into their drawer and grab their Medicare hat and take off whatever hat they were previously wearing in that previous appointment, and then they're going to have to walk you through that. So they, in a sense, yes, it's their responsibility to be an expert at all, but another thing I'll say is just pretend, just assume, go under the assumption that they are in training and it's their first few weeks on the job and they're putting their Medicare hat on.
Yeah, and here's what I would recommend to every single independent agent that's out there kind of wondering, especially I think that this would probably affect newer agents more than anyone, is I want to encourage you to think like this is a business, right? You're an independent agent, but imagine that this is your business. It's not just a job. And we need to make that distinction. And the reason that's important is because when you have a job, everyone else pays for that, right? They're paying for your E&O, they're paying for your, your CRMs and things like that. But when you have your own business, this is your investment, but you're investing into your future. Hey everybody, welcome back to Medicare Agent IQ. I'm Raul Gonzalez.
And I'm Oscar Ibieta.
And so today we're going to actually just kind of finish where we were last week, where we're going to just go ahead and answer a few more kind of what I would feel are kind of more basic questions for Medicare, but a lot of agents maybe haven't kind of figured some of these things out. So.
Yeah, it's good just to be able to provide clarity. There's a lot of different Facebook groups or just online resources where people go to and ask these questions, but I don't know how you feel, but sometimes when I read through the responses, at the end of it, I feel like whoever posted that original question is probably still a little bit confused just because there's so many different answers that they get back to that. So
a lot of sometimes trolling answers too, like
right.
Just like the complete opposite of what it's supposed to be. And you're like, what am I supposed to do? So,
so we're just gonna pick up where we left off last week, and so we'll just finish up. We've got a few more questions that we want to go through with everyone, and so we'll just talk through them, and that'll get us through today's episode.
Yeah. So if a person originally refused Part B when they turned 65, can they enroll now?
So that's a question that you'll run into in the field quite a bit. And the short answer, or the simple answer, is unless you have creditable coverage, or you've recently lost creditable coverage, then the answer is no. You'll have to wait until the general enrollment period. And so you see that, and when is the general enrollment period? Well, that's January, February, and March of every single year. So yes, if you run into somebody in April who does not have Medicare because they originally refused it when they turned 65 and they don't have creditable coverage where they're able to come off, talking about the last question that we just discussed, if they don't have creditable coverage currently, they're not able to enroll into Part B, or if they don't have that special enrollment period where they recently lost the creditable coverage. So if it's April and you're having this conversation, this is where we have to deliver that news and say, hey, look, unfortunately, we're going to have to wait until the general enrollment period, and that's not until January. Cool thing about the GEP, for those, if we have any veteran listeners, in the past, if you enrolled somebody during the general enrollment period, January, February, March, their Part B coverage wouldn't go into effect until July 1st later that year. Kind of a weird...
Dude, it was so annoying. like, okay, well, you signed up, but now you got to wait until, which was really kind of frustrating if you were a person that, if you didn't enroll, if you decided to enroll April 1st, and then you basically have to wait a whole year, but then you have to wait, really long time when it shouldn't be that way. So it's kind of cool that was a rule change, because that was a frustrating rule, I'll tell you that.
Yeah, so the new rule is your coverage goes into effect the first of the following month. Again, talking about GEP. So if somebody's applying in January, of the general enrollment period for Medicare. Again, we're talking about getting Medicare, not signing up for an Advantage plan or anything else like that. For Medicare, it would go into effect on February 1st. Or if it's done in February, then it would go into effect March 1st. And if it's done in March, they have up until March 31st, then they could sign up for it to begin on April the 1st. So immediate coverage the first of the following month when you enroll during the general enrollment period.
You know, it's funny. I actually had an agent of ours come in to my office today and kind of mentioned that they had a client that did not enroll into Medicare Part B, and they went down to the Social Security office and told them that they needed to sign up, and the person said, you should have planned ahead. You don't get an appointment until June to sign up for Medicare Part B. And I kind of, you dig more and find out, well, he didn't like choose to leave his job. He was let go, and he was kind of given that pushback. Have you ever heard of that?
I mean, I haven't run into a situation.
I hadn't either. I was like, I don't know what to tell you here, buddy. Like, call and speak to someone else, which, to be honest, like, it's kind of a frustrating thing, but sometimes you have to call and speak to someone else, even with Social Security, even with Medicare. So,
yeah, one thing that I'm constantly reminding our agents about is when you're dealing with somebody at Social Security, or when you're having a client deal with somebody at Social Security, you've got to keep in mind that the people there at Social Security, they wear so many different hats. So if you scheduled an appointment, or you walk into that Social Security office and you sit down and meet with somebody, I just picture this. Picture that person is going to have to kind of reach into their drawer and grab their Medicare hat and take off whatever hat they were previously wearing in that previous appointment, and then they're going to have to walk you through that. So they, in a sense, yes, it's their responsibility to be an expert at all, but another thing I'll say is just pretend, just assume, go under the assumption that they are in training and it's their first few weeks on the job and they're putting their Medicare hat on. So you want to try and educate your clients as much as you possibly can and prepare them for when they go into that appointment there at Social Security.
Right. Absolutely. So on to the next. Question number 2 is Cobra coverage, or is Cobra creditable coverage for Part D and for Part B?
It's a great question. There's always constantly confusion on that. So here's the answer that everybody has been wanting or looking for. So Cobra is creditable coverage for Part D. D as in dog, D as in drugs. It is not creditable coverage for Part B. B as in Bravo. So there it is, right? Creditable coverage.
And I'm going to correct that answer just a little bit. I guess the answer is it could be creditable for Part D, as assuming that it's at least as good as Medicare Part D.
Yes, that's the asterisk there.
Right. Yeah, and the reason I give some clarification is because not everybody's retiree coverage, employer coverage is
as good.
Equal. Yeah. So so there's some that are not. So it's got to be at least as good as Medicare.
Yeah. So assuming that it is, the answer is yes for Part D, but it's still no for Part B.
That's right. And so I will tell you that recently that is something that is being looked at, because it doesn't make sense that you are insured. Why wouldn't it be creditable?
Right.
And so that is something that's going to be looked at, that probably by next year there would be some, wouldn't surprise me if there's some changes. Yep. So that's the answer for that. Any other thoughts on that?
No, I think we're ready to move into the next question, which still ties into some Cobra.
While we're here, while we're here, I was thinking about VA coverage.
Yeah, let's talk about it.
Kind of the same thing, right? So it's not creditable for Part B. You will get a penalty if you're not enrolled in Part B, but if you have VA coverage, it is creditable for Part D.
For Part D, yeah. So they won't be subject to that Part D late enrollment penalty, which we can actually back up to the previous question. And if you meet somebody who's got VA and they want to enroll in Part B, can they do that now? The answer is no. They have to wait until the general enrollment period to do that.
Yeah, all these are tied in, right? Like, I mean, just there's like and this is one of the things that's kind of frustrating when I see a lot of times agents are not being fully trained, And it's like, man, there's so much here to learn. You've got to make sure that you're figuring this out. The reason it's important for you as an agent to figure it out is because you're giving people advice. They're coming to you as an expert. So you want to know, even though, like, is it really my job to know this? No-ish, right? Like it's like but we should,
I would answer yes. I mean, if I'm going to be out there in the field and giving advice and guiding people, personally on a personal level, I would say yes, we want to have the answers to that. That's those having information or having the answers to that outside information is what's going to make you a better agent out in the field. And ultimately, it's going to lead people to choosing you over another agent. And this is just, a reminder, right? We're in sales and we have to sell ourselves to our prospects and make them choose us, because they can go to another agency assuming that it's a broker who represents multiple carriers, or they can just go online and find the coverage it is that they're looking for. So give them a reason to choose you, and just adding all this information to your knowledge bank and being able to answer these questions and talk them through these situations and scenarios just makes you that much more valuable when you're out in the field and talking to people.
Yeah, for sure. Absolutely. Number 3, if someone currently does not have Medicare, does loss of Cobra coverage create an SEP to enroll into Medicare?
That's a loaded question, I think, and there are a lot of layers to peel back when we try to break that down. So I'm gonna repeat the question to our listeners. Someone currently does not have Medicare. Does loss of Cobra coverage create an SEP to enroll into Medicare? So the answer to that depends. So really, the question is, can we get on to Medicare? And when someone loses their coverage through their employer, it creates an SEP. And at that point, they have 8 months from the time that their coverage ends through their employer to enroll into Medicare Part B. What we see, or what we'll run into, is we'll say, well, I have the option to keep Cobra, so I'll just stay on my Cobra, and they're letting me keep that for 18 months. Can I just go ahead and keep that? And then once the 18 months is up, then I'll go ahead and enroll into Medicare Part B. Well, you may run into some issues 18 months from now, because going back to the first part of my response here was you have 8 months to enroll into Medicare from the time that you lose your coverage through your employer. And if you don't do so within those 8 months, now you're subject to the general enrollment period. So you'll have to wait until January, February, or March. So if someone takes Cobra for the next 18 months, and 18 months from now, it puts us in October, it just 18 months from now ends up in October, hey, my Cobra, and they call you and say, hey, my Cobra's ending, can I go ahead and enroll into Medicare Part B? Now you have to give that tough answer and say, you can't. You should have enrolled into Medicare Part B within 8 months from the time that you lost your coverage through your employer. Now we have to wait until the general enrollment period. We're going to have to wait until January to enroll you into Part B. So now they're running the risk of being uninsured until they're able to get their Medicare Part B coverage. So if you can have this conversation with someone on the front end who's losing their coverage and they're telling you, hey, Raul, I have Cobra as an option, I think I'm going to go ahead and take that. Make sure that you educate them and say, hey, look, I know you can have it for the next 18 months, but make sure that you enroll into Medicare Part B within the next 8 months.
Right. So the question that I have for you then is, if a person were to enroll into Medicare Part B, and then choose to stay on Cobra, which I wouldn't recommend, right? But if they decided to do that and they were on Cobra and that Cobra ends, does that then give them an SEP to enroll in a Medicare Advantage plan?
So that changes things, and the answer is yes. It does give them the opportunity. Now it kind of falls under the umbrella of losing your group coverage, or losing, in this case, the Cobra coverage. They'll have 60 days to go ahead and enroll into coverage from there, assuming that, like going back to your point, they enrolled into Part B but chose to keep their Cobra coverage. But so only if they did enroll into Part B, they'd be able to do that.
Yeah. I think that's a real important thing, and for agents to have that distinction, to know that. So
yeah. So one might be thinking, if you're listening, well, why would somebody enroll into Part B and then still keep their Cobra coverage? And I'm sure there's probably a reason behind it. One example could be, well, I want to keep Cobra coverage because my wife is turning 65, 6 months down the road. And so it just makes sense. I'm going to keep her covered because I don't want her to go through a marketplace plan, or we don't have any other options. So I'm going to go ahead and keep her on Cobra, or keep us on Cobra until she's Medicare eligible.
That's a real good one. Yeah, I was trying to think that, or the benefits of that plan could be really good. Maybe the benefits of the plan could be really good, and I have a really good network, and just decided.
Yeah, maybe they're on certain medications where it just still makes more sense.
Or if you're a RIFT, and part of that reduction in force is that you were they're paying for your Cobra so there's a few reasons that it could happen, but it's important just to know these things. So on to the next. Okay, you've got an individual who's on Marketplace and they're turning 65, and they ask if they can keep their Marketplace plan because it's cheaper than Medicare. So would they be allowed to?
They can keep their Marketplace coverage, but the kicker is they're no longer eligible for subsidy. So
any at all, not even like lowering of the deductible or anything like that.
Right. Yeah. Because you can get a subsidy like on the premium itself, but then you can also get a lower deductible and a lower max out of pocket. You're not eligible for any of those things if you are eligible for Medicare. So if someone's going to tell you, well, it's cheaper for me to keep my Marketplace plan, you're saying I got to pay this year. Medicare's $174.70. Why would I want to pay that much if my Marketplace plan is free? They might say that. It's like, well, let me tell you, you're receiving a subsidy. They're reducing your monthly premium. So yes, you can keep your Marketplace coverage. However, you're no longer going to be eligible for subsidy. So you're now going to be you're going to be responsible for paying the full price of that plan, which you can almost guarantee that it's going to be higher than $174.70. So it just makes sense for them to go ahead and transition into Medicare. So we see that question more often than you think. Agents are running into that, and they kind of get stumped by that question. Or you might even walk away from that piece of business because they say, well, it's cheaper for them to keep their Marketplace plan than it is for them to take Medicare. So, I wasn't able to convince them to take their Medicare. Well, it's not a matter of convincing. It's a matter of, hey, if we have this knowledge and we know how this works, let's deliver that information to them and say, hey, you're no longer eligible for subsidy. You're going to have to. So it's going to make more sense for you to go ahead and take Medicare rather than staying on the Marketplace plan.
Yeah, for sure. And, sometimes you'll get challenged by the person who's turning 65, right? And they're like, no, I don't want to do it. And just they'll even give you kind of like a hard no. And they're like, well, I'm going to test it out and see, right? And so that's an unfortunate reality, and too, of sometimes dealing with the people who are getting those very large subsidies on the Marketplace is that they will challenge it, and they're going to try to stay on, and then honestly, they might end up getting surprised at the end of the year, right? When they lose that.
And think about this, right? Let's dive deeper into that. If they're receiving a very large subsidy, well, then let's screen them and let's see if maybe we can get them qualified for at the very least LIS, right?
Probably could, right? Because it's 250% of the poverty level, and at least in where we're at.
Right. And then it's like, well, let's see if we can get you qualified for Medicaid, whatever the name of that program is in the state that you're in. Here in Texas, it's called the Medicare Savings Program. Some states, California, it's Medi-Cal, and Florida's got a different name for it. I don't know. But again, see if you can screen them for that and see if you can get them qualified and just give them that information, especially if they're giving you that pushback. Like you said, it's like, well, there are other programs on the Medicare side where you may qualify for some discounts on your prescriptions, maybe even get your Medicare premium paid for and lower your out-of-pocket expenses. So have that conversation with them. But again, let's build this knowledge. Let's fill ourselves with knowledge so that when we're out there and we're having conversations with people, we know exactly what to say. We're ready to fire off with some responses.
Right.
Got a question for you. This one comes up often. I hear I've heard that people can no longer enroll into Plan F. Who can enroll into Plan F? So talking about Medicare supplements, who can still enroll into Plan F?
Yeah, that one is it's very easy but very difficult to explain sometimes. And really, the way that it works is that anyone who was on Medicare prior to January 1st of 2020 that's the guaranteed issue plan that they would enroll in. They basically, what they did is they said anyone who had Medicare prior to January 1st of 2020 will have the old rules. And then anyone who had it afterward gets the new rules, which means that the guaranteed issue plan, the guaranteed issue option is Plan F if you had Medicare prior to 2020. But that also means that you can shop around and still buy Plan F if you are a healthy. Let's say that you had Medicare in January of
2019.
Yeah, I was going to go further back.
All right,
yeah, sure. We'll say
2015.
19. Yeah,
2015.
2015. So you're coming up on 73, 74 years old, but you're young or you're healthy. You've taken good care of yourself, and you want to change your Medicare supplement plan. You still have the option enrolling in Plan F. So which is great. So that's a very big thing. If you ended up in a guaranteed issue situation, let's say you were working up until you're 73 and you were leaving that and you needed to use guaranteed issue, the plan that you would enroll into is Plan F. If you got Medicare after 2020, after January 1st of 2020, the plan that you would get guaranteed issue into is Plan G.
Yep. Yeah. So underwritten business or guaranteed issue, if you were eligible for Medicare prior to 2020, that's when those are the people that can still enroll or, attempt to enroll into Plan F if it's underwritten business. So personally, when I'm meeting with people, if I come across somebody who's on a Plan F and they've had Medicare prior to 2020, I definitely still take the time to open up a conversation about Plan G and just explain the difference to them, because many times financially it does and can make more sense for them to go on to a Plan G than it would going with a Plan F. But really, I've also met with somebody who's like, no, I don't want to change the type of coverage that I have. I want to remain on a Plan F. It's like, okay, well, you still have that. It's still an option for you on the table. So let's go ahead and go with that one.
Oftentimes for people who had Medicare prior to 2020, the Plan G premium is significantly less expensive. And people who chose to get on a Plan G, even before that, they've seen their rates increase significantly slower than people who chose a Plan F. And the reason for that is, and it's something that's super important that I want to make sure to share with everybody, is that back when people prior to 2020, the option we just talked about was to enroll into guaranteed issue into Plan F. If you were 68 and you wanted to enroll in Plan G, you would have to go through underwriting in order to do that. So this was for people prior to 2020. So they'd have to go through underwriting. Plan F had to accept everybody. No questions asked, whether you could be 75 years old, leaving your employer coverage and get into a Plan F. Obviously, regardless of health. So if you were in the middle of dealing with cancer and things like that, obviously that's going to increase the cost. So what we saw is Plan F premiums were going up significantly faster than Plan G. So for people who have Medicare after January 1st of 2020, it's a different story, right? Yep. Plan G is the option that they get that guaranteed issue into. So we're seeing those rates go up much faster now, and so the option, kind of the next best option that would make sense for people that don't have those guaranteed issue, situations is Plan N, and so that's why we're seeing so many people. That's why we're seeing the premiums on Plan N significantly less. But in addition to that, in addition to the fact that they're significantly less, they also tend to go up slow. The rates tend to go up slower.
Yeah, there's more stability.
There's much more stability.
Yeah, I'm glad you brought that up. I was going to try and speak to that, but I was like, I don't know if I can really put the words together. Yeah, so I'm glad you did. Yeah.
Sometimes I feel like, especially with stuff like that, you feel like you're talking in circles.
Yeah.
I hope that made sense. And if
it didn't, send us a message.
Yeah, and we'll explain it a different way. Hey, real quick, those really all the questions I wanted us to cover today. But just for agents out there that are struggling, and how would an agent stay motivated? There's so many things going out right now with the proposed rule I guess it's the final rule. We're still waiting for the carriers to put out their interpretation, and ultimately that's what everybody's waiting for. And we had NABIP come out and say it's business as usual, but kind of speaking with some carriers, they're saying, hey, we still don't know exactly what everything looks like. Meaning, are they able to pay for your retail locations? Are carriers allowed to help pay for your special events, even sponsoring that birthday cake for a birthday party? How do you stay in as an agent, staying motivated? What are your thoughts? Just
if I'm an agent out in the field, I'm like, my mindset is business as usual until we hear otherwise. So I'm not going to take my foot off the gas and say, well, let me wait and see what's going to happen. I'm going to continue to try and capitalize on any opportunities that I can. And really I might even take it up and put it into the next gear and say, well, I've got to get out there and I've got to work harder to build more relationships with providers and senior communities and senior centers and just getting
where
out
you can
there.
Get free leads.
Where I'm not having to pay for these things and try and beat other agents to this, because if it does end up where we're not getting support from the carriers for these events, well, let's get out there and let's get in front of people where we can get opportunities to not have to pay for these leads.
Yeah, and here's what I would recommend to every single independent agent that's out there kind of wondering, especially I think that this would probably affect newer agents more than anyone, is I want to encourage you to think like this is a business, right? You're an independent agent, but imagine that this is your business. It's not just a job. And we need to make that distinction. And the reason that's important is because when you have a job, everyone else pays for that, right? They're paying for your E&O, they're paying for your, your CRMs and things like that. But when you have your own business, this is your investment, but you're investing into your future. You're investing into what this could be. And so keep that in mind, and then approach it in terms of revenue, like, hey, look, I'm going to invest this dollar amount into lead programs. I'm going to invest this dollar amount into different things that are going to generate opportunities to the different marketing, and then think of it in terms of, okay, well, this is my return on investment, and you're going to have to start thinking more like a business person. What I'm hearing is that carriers may be paying for less for agents. And so I'm not saying you're going to be out on your own, but you're going to have some responsibility. But just remember, it's an investment. It's an opportunity for you to go out there and build a very big, successful business. So just stay encouraged in that, and just know that, for a lot of time, like a lot of our agents, they haven't had to pay for a lot of their marketing. They haven't had to pay for a lot of those things. If those times change and you're having to pay for a little bit more, just remember, it's your business, and right. it was always your responsibility. You just got a lot of help. Yeah. So that's all for today. Just kind of wanted to touch on that. There's a lot of agents that we get questions about it all the time. And if you look at even through the different Facebook groups, people are always, even till this day, have questions. And the reality is, it's the reason we don't have an answer is because the carriers still haven't put it out there. So we also would love carriers to get us some answers as soon as possible. So
hopefully soon.
Yeah. So until next time, do us a favor. Make sure you follow all of our social media. We're on Facebook, Instagram, TikTok, and YouTube. And so we'd love for you to engage with our content, ask any questions. And we're also always looking for success stories to share on our story. So if you feel like you have a success story that you'd like to share of how you became successful and how to be successful as a Medicare agent, we'd love to hear from you as well. So thank you so much.